Imagine you have a new pair of shoes. As you walk, you notice that your shoe is rubbing. You take it off and you see a small blister. You put a band-aid over it and 2 days later the wound is gone. Now imagine you have diabetes. You don't notice your shoes are rubbing because you've lost some of the sensation in your feet. The blister turns into an ulcer. Eventually your doctor notices and begins treatment, but your healing is impaired. Despite the best treatment, the wound gets infected. The infection gets into the underlying bone, and eventually the only option is the amputation of your foot. It's hard to imagine that a small blister could lead to an amputated foot. But for a diabetic person who gets a foot ulcer, 1 in 6 of them require an amputation. This is enormous because 1.8 million Australians have diabetes, and that number is growing. For many people, early on, they don't even know that they have diabetes because early on there are no signs. These undiagnosed years can be when the high levels of sugar in the blood are damaging the nerves and the arteries that lead to these chronic, non-healing wounds. Managing these wounds is challenging. We have national guidelines for the treatment of diabetic foot ulcers, but often these wounds aren't being overcome by the methods. We need new ways to beat the wounds, and we have one. It's called low-level laser therapy. It's as simple as holding a light-emitting diode close to the wound for around 90 seconds a day. The light stimulates the cells that help us heal, and studies have already shown that this laser therapy improves healing in diabetic patients. Our study is titled "The Effect of Low-Level Laser Therapy on the Wound Healing of Chronic Diabetic Foot Ulcers in Type 2 Diabetes Patients." We're conducting a trial that will provide the high-level quality evidence needed to include the laser therapy in national treatment guidelines. We're doing this by using a randomised, double-blinded, placebo-controlled clinical trial with 140 patients. This means we have 2 groups. Both will receive exactly the same wound treatment care and laser, but only one group will be receiving the therapy level of laser. This will let us measure the success of the laser therapy. If successful, our results will let us push for this treatment to be put into national practice, having a direct impact on the 1.8 million Australians who may need to manage a foot ulcer. If we can halt progression early, we can keep these people from the life-changing burden of amputation. Thank you.